Good evening, everyone, and welcome to our event. My name is Dr. Danielle McCamey. I am the founder, CEO, and president of DNPs of Color. We are so excited.
I think you're muted.
Yes, I am muted. Thank you so much. Good evening, everyone. Welcome to our event, the State of the DNP Degree Roundtable Discussion. My name is Dr. Danielle McCamey. I am the founder, CEO, and president of DNPs of Color. It's such an honor to share this time with you and have this wonderful discussion. I will be serving as one of the co-moderators, and I will pass the mic over to my other co-moderator, Dr. Kesten.
Hi, I'm Dr. Karen Kesten. I'm so pleased to be a co-moderator for tonight's event. I'm an associate professor at the George Washington University School of Nursing and an outgoing member of the advisory board for DNPs of Color. And now I'll turn it to our panelists.
Welcome, everybody. My name is Michael Williams. I'm from Brooklyn, New York. Currently, I serve as a student representative. I'm a student at Lewis Harrington School of Nursing at Baylor University. And I would just like to introduce our mission, which is to serve DNPs of color through networking, mentorship, and advocacy to increase diversity in doctoral studies, clinical practice, and leadership. Welcome, everybody.
Good evening, everyone. I'm Dr. LaDonna Brown. I am a nurse anesthetist and adjunct faculty at the University of Arizona. I am coming to you live from Washington, D.C. Just a few rules for tonight, the State of the DNP Degree. We would like for you guys to keep yourselves on mute. All of your questions will be in the chat. And if you would, please do us a favor and post your social media information in the chat so we can network.
All right, and with that, we'll go ahead and get started with introduction of our panelists. Dr. Gallegos, if you would like to get started.
Good evening, everyone. My name is Dr. Julian Gallegos, or as my students call me, Dr. G. I work at Purdue University, West Lafayette, Indiana. I am a clinical associate professor, DNP program director, and currently the interim assistant head for graduate programs.
Good evening, everybody. My name is Imelda Reyes. I am currently a professor at the University of Nevada, Las Vegas, and I am the Associate Dean for Advanced Education, and I am an outgoing advisory board member for DNPs of Color.
Good evening, everyone. I'm Dr. Cheryl Thaxton. I'm here from sunny Dallas, Texas. I'm a clinical associate professor at Texas Women's University, where I'm also the DNP program director, and I'm an advisory council member for DNPs of Color.
Excellent. Thank you so much. Karen, you want to go ahead and get us started with the first question?
Absolutely. Welcome, panelists. We're from all over the country. It's wonderful to meet with you tonight. The first question that we'd like to begin our discussion with is, do you think that the DNP degree has evolved since its inception? And if so, what do you see is changing?
So I'll go ahead and start with that. I believe that the DNP degree has evolved significantly since its inception. I think in key ways. So I think it was in the early 1990s that the DNP was initially proposed, but it wasn't until 2004 that the DNP actually came into existence. And I speak to these historics because I'm not a DNP prepared nurse. I'm a PhD prepared nurse, but I value the role of the DNP. We saw over time a significant amount of institutions that eventually increased or developed DNP programs throughout the nation. The ways that it has evolved over time is that there has been an increasing emphasis on practice, specifically for advanced practice nurses. We oftentimes traditionally think of advanced practice nurses as just being the nurse practitioner, midwife, CRNA, clinical nurse specialist. But I think over time, it'll continue to evolve, and hopefully it'll include other specializations like healthcare leadership and those sort of things. But I have seen that the DNP degree as a whole has evolved. Also, I think I've seen a lot of evolution in regards to integration of technology, and more so for advocacy and health policy within nursing. Not a lot of PhD nurses focus on health policy and or advocacy, and I think the DNP degree has done a lot of work specifically to that. So that's just a little bit about the evolution that I've seen over the period of time that I've run a DNP program, not only in Indiana, but California. And I hope, and I'm excited to see the evolution from this point on.
And I think I just wanted to add another thing for some of us. I was looking, for a doctoral degree that would allow me to teach, because certain institutions were requiring the doctoral degree. And I think what's interesting is on the flip side, for PhDs as well, not all programs include, how to be a good teacher. And so I was fortunate, and I found a program that did have a concentration in that area. But I think it's definitely another thing that I hope to see evolve, because we are the ones teaching future APRN students, and I just think it's important that we think about the skill set of being a really good educator as well.
And I definitely want to piggyback off that. I've been an advocate for DNP education for a long time. And I do think that the degree has certainly found its place in the setting, both academically and professionally. As the State of DNP Education report showed, the numbers of students and programs are increasing in leaps and bounds. I think it took some time for external partners to articulate the difference between a nursing research doctoral degree and a clinical practice doctoral degree. And so we had to be that voice to advocate for ourselves, to show and articulate the difference. What's the difference between a dissertation and a quality improvement project, for example? We had to become clearer voices in articulating those differences with confidence. And the degree itself, in terms of evolving, does promote a sense of confidence in our own strengths as nurse leaders by really propelling us to continue to occupy seats at various tables for the sake of patient advocacy and policy-related issues. So DNP projects are no longer like mini dissertations. Now the projects are totally, streamlined, very clear. They're being presented at national conferences. Both DNP and PhD faculty are partnering to ensure congruency in areas such as advanced practice and evidence-based practice and implementation science. So I think the evolving has been ongoing, and I'm seeing it more and more.
That's excellent. I love the different viewpoints about the evolution of the degree. And, just to kind of toss in, do you all think that the evolution has been to our benefit? And then if so, what value do you all see the potential different facets having a DNP degree could be to practice, education, leadership, from your perspectives? And I'll toss that to Dr. Reyes.
Yeah, so I think one of the things that I find interesting is that there is such a difference in a variety of the way the DNP curriculum is, developed, executed, and I think it muddies the waters just a bit in terms of what exactly we're producing and how we're meeting these different needs, and so I think it definitely makes it difficult, when to become a certified, APRN or something, there's an exam, but it doesn't include a lot of the things that we take in addition when we do the DNP. And so, so I struggle sometimes with just, how best to articulate the differences between like the clinical degree, the executive leadership degree, the education component. And I think, again, it's just really hard to meet all those needs with one curriculum. And so I think some places do it well, some places maybe not as well. But I think it definitely, adds to the conversation.
Awesome. And I think, Imelda, you bring up a good point about muddying the waters. And so how would what's your elevator pitch on when someone asks, like, what is being DNP? You have your DNP, like, how do you explain that to someone that may not be in the industry in 30 seconds or less? Like, how do you describe it so they understand the value and capture the depth and breadth of scholarship that comes with being DNP prepared? And so I'll pitch that to Dr. Thaxton.
Great. Yeah. So I think the values added in active skills that are unique to the DNP, like systems-based thinking, the things we learn in terms of nursing informatics and evidence-based practice, right? And how do we put those into action in the clinical setting? And also the return on investment for the DNP degree itself. DNP leaders are now seeking roles as chief nursing officers, vice presidents of health systems, C-suite nurse executives. And also, when you think back to the COVID pandemic, the height of it, a lot of it was navigated with DNP leaders at the forefront. So we do have a lot that we've added in terms of showing what we can do and our knowledge, but there are some gaps that we've had to tackle over time with explaining kind of who we are and what we do. And those do go back to education, practice, and leadership. We need to be able to speak strongly about how we have advanced in those areas and what we can bring to the picture, especially in terms of our, return on investment for the actual degree.
That's awesome, but I want to dig a little bit more. What's your elevator pitch when someone says, "Okay, Dr. Thaxton, so what does that mean? You have your DNP."
So my elevator pitch is definitely, clinical expertise. My expertise is definitely palliative care, but when the students come to us, we want to make sure that they're tapping into their area of expertise, and their clinical practice, their DNP project hones in on their skill set where they actually are making practice changes in their clinical setting, or if they work in an academic setting, because we do accept non-APRNs now. But those skill sets are boots on the ground skills they can use to make, to add to better care for patients and their families, and definitely utilize skills such as emotional intelligence, resilience, true leadership, and collaboration with interdisciplinary team members. So our students are not necessarily going to do research, right, where they're going to bring some new thing, to the table for their team or their practice, but they are going to reshape the care through utilizing that implementation science to build feasible and sustainable models of care. So I have a true interest in making the clinical setting better. Someone else might have an interest in doing the research that makes it better. So when we talk to our doctors or our partners about why we chose whichever degree we chose, we need to be able to articulate that and state it well so that they understand, because they're still trying to understand why we chose whichever degree, which degree we chose.
Thank you. Anyone else want to take a stab at the elevator pitch?
Yeah, I'll just add. So, I get calls all the time from students who are wanting to look either at our PhD or DNP program. Obviously, I'm a little biased. I run the DNP program. So I say to them, that the DNP program is often seen as the bridge between academia and practice in nursing. And it's for a good reason. As healthcare becomes more complex and challenging, nurses with advanced knowledge and skills are needed to bridge the gap between theory and practice, and to ensure that the latest research and best practices are being applied in actual real world settings, which is what Dr. Thaxton mentioned. But the DNP does more than just bridge the academic practice gap. It also helps to transform nursing practice by providing nurses with valuable skills and knowledge they need to be effective leaders, innovators, which is a great one, and change agents in their organizations and their communities overall.
Awesome. Karen, what's your elevator pitch?
Oh, my elevator pitch. Oh, I had a burning question on the tip of my
Sorry,
tongue.
go ahead.
That's all right. Well, that is one of the exercises that at George Washington that we have our students do, is actually, on VoiceThread, do an elevator pitch. And it really evolves over the course of the program. When they first begin, they're really not able to articulate clearly what the value is that they bring. But we try to help them focus on articulating the value. And that was where I was going to springboard into talking a little bit about the research, showing that, the numbers of folks going into the DNP programs are increasing in the executive leadership track. And so now we have many more employers who are hiring nurses, chief nursing officers, nurse managers, directors of, divisions in academia as well. Those areas are really growing in representation of those who are DNP prepared. But what the research has found, interestingly, is that employers have a very difficult time measuring in measurable terms what the value is that the DNP brings. What would you suggest as panelists that we look at as ways to leverage measurement of value of the DNP?
I guess I can.
What outcomes would you recommend?
Go ahead, Dr. Reyes.
Well, I was just thinking, from an outcomes perspective, one of the things that, I always share with students that are going through the DNP is the skill set that we're giving them, in terms of evaluating the evidence behind what they're doing, that population health perspective that they can bring to the table, the ability to understand the resources, because I think, I've seen the two spectrums where, a nurse practitioner is able to quantify what they do, and then those that cannot. And so they're subject then to, whatever the practice does is kind of, what they're left to do. And they don't know what kind of value they bring to the clinic. They don't know, and so I think it's really being able to, quantify what it is that you bring. And from an employer standpoint, I think having that well-rounded, whether it's an executive leadership type nurse, whether it's an APRN, person, just being able to really showcase what those additional skills bring to the table. And, being able to, somebody mentioned, take that research that's out there that's being produced and translate it into better outcomes. And so I think that's where we show our value is, by those measures, within healthcare, and being able to, speak to, what's out here, and then how does it impact, the health and bottom line for, different organizations.
And just to add a little bit about that, obviously, I've been out of the acute care setting for a while, but I do still practice clinically. And I think that certain outcomes are actual tangible outcomes, obviously, for a lot of people who are leaders in these organizations is the cost, right? So if we can show that DNPs in all different specialties, showing that they're able to reduce cost for the organization is significant. Also increasing patient satisfaction. And then we always go back to our default, the care that's provided to the patient, the quality care that's provided, which that's what I love about the role of the DNP is that it's boots on the ground. Someone mentioned, I think may have been Dr. Thaxton. These are the people at the point of care, just like a bedside nurse. These are the individuals who are serving that patient directly. So I think there are a lot of different opportunities to assess outcomes. It's just finding the right outcomes for the specific role that DNP prepared nurse is filling.
And also paying attention, especially within hospital systems and organizational leadership things like overall growth of programs, patient outcomes, metrics that matter, that lead to magnet status. Are we at the table for those meetings to help promote the organization as a whole and the mission and vision of these organizations? So DNP students and DNP leaders are in these meetings, and they are extending knowledge and wisdom at the table and being respected.
If I could just give one example that happened to me today. One of my graduating DNP students presented the outcomes of his DNP project at a large urban acute care setting. And he used innovation and technology with, of course, text messaging and phone calls for patients who are being discharged from both surgical and medical units to remind them about coming back to reschedule their appointments and questions about their meds. And then he looked at HCAP scores, over 700, almost 800 patients that he followed, and, you know, really demonstrated that over 30 days, they had a 0 readmission rates among those patients, you know, that of course they had to have a cell phone in order to participate, and there were some limitations, but I think it's more about also encouraging innovation in the role. You know, being able to, when you're being hired, some of you are students getting ready to graduate, you know, joining us tonight, being able to really negotiate for some time in your role or innovation in your role to be actually able to measure outcomes that you know you're able to produce, costs, outcomes, return on investment, and looking at HCAP scores in acute care settings in particular. I want him to publish in the new journal for the doctors of color, right? DNPs of color.
And that's interesting. Julian, I think you mentioned earlier that, you know, there is a substantial increase of DNP programs over the past couple of years, which I always quote this statistic that from Campaign for Action, they looked at data over a decade and found that over that time period, over 50,000 DNPs had matriculated through programs to over 7,000 PhDs. And so my question to the panelists is, one, why do you think that exponential growth occurred? And then two, does this create an opportunity for DNP prepared nurses, or do you believe that it could be perceived as a negative thing given the exponential growth? And always there's a call to question on the variability in rigor and program requirements that have kind of essentially created this different variety or variance within how the DNP is, the curriculums are and how they show up in practice. So one, why do you think the exponential growth has occurred specifically for DNP degree, and how is it potentially beneficial or negative for nursing profession?
I'll start. So for me, in terms of the growth, you know, when I was looking, when I was a clinician at, you know, seeing patients, and I started thinking about, you know, where I wanted to go next, I, you know, had considered the PhD, but when I learned more about the DNP and I realized that it would really enhance the clinical skills, I was in previous life a healthcare administrator, and I just thought the DNP was a better fit for me. And so it really kind of got to that systems level thinking that I thought was really important. I didn't feel like I would get that with a PhD, and that's not where I was interested in going. And I think that's really grown and added to the proliferation of people getting their DNPs, because I know I've talked to a lot of clinicians, and they didn't have a PhD or a DNP option when they, you know, were going through that. And so many of them, you know, would say, oh, you know, if the DNP would have been around, that fit better with my trajectory of like where I wanted to see myself. From a benefit, you know, like whether or not it's beneficial, I do think that the variability does, you know, I mentioned it before, muddy the waters a bit, but I think it's nursing in general, though. It's not just the DNP. And what I mean by that is, you know, the fact that like nursing is governed by a number of certification bodies, a number of accrediting bodies, you know, whereas other disciplines are not. I think that adds to the confusion and some of the issues that we see. But, you know, again, I think it's a greater nursing issue.
So in regards to those questions, I'm going to add a little humor here, and I hope everyone takes it in the right way. I might mean it. So we need to take away the stigma that the DNP is just the other white meat. It's not. It's the same. You know, we're from the same piece. We're cut out from the same piece of cloth, however you want to put it. And we need to, you know, I am a big advocate for people not describing the DNP as lesser than a PhD. we are equal.
Mhm.
And we're symbiotic, right? We should have a symbiotic relationship with each other, PhDs and DNPs. So I think starting there, and so I think that a lot of people believe that the increase in DNPs just in general in the nation has been detrimental. I think otherwise, because most nurses who go into nursing want to remain clinicians. And that's what the DNP does. It allows those nurses who want to remain taking care of patients, using the evidence to support their practice, to do that. PhDs, unfortunately, we get sucked into the realm of research, and sometimes even in the depths of academic leadership, and that pulls us away from our patients. So I think we just need to rethink of and teach people to rethink that DNPs and PhDs, we work together. It's not a bad thing that we have a bunch of DNPs. Just it's almost synonymous to, we have more RNs than LPNs. We're all on the same team, right? And we all provide care. So I that's my little spiel on that.
I definitely agree, Dr. G. I think it's over time has evolved into much more of a partnership and not really a competition. For instance, most recently, they've started to invite DNPs as clinical experts on PhD dissertations. I've served on one last year. And I think those types of partnerships, as they go along, will show and demonstrate to the community, that this is a collaboration, that we do have skill sets that feed on one another, and that we are still both, all about evidence-based practice and helping our patients and families. So I do think that it's a positive.
I would like to add that I think the onus is on us in a way that are DNP prepared to reach out to our PhD colleagues and partner with them in a practice setting in particular. They might really be able to help us measure these outcomes and think of outcomes that we might not have thought of. I mean, we both are approaching a problem, but with different lenses. And I think that my partnerships have enhanced my PhD colleagues' knowledge of what my expertise is as a DNP prepared nurse. And so, one of our call to actions might be to not be hesitant to reach out and partner. What do you all see as the future opportunities for DNP prepared nurses? In particular, I was thinking about academia, practice, and policy.
Well, I can speak to practice gaps, in the literature still point to areas such as rural health and underserved communities, right? And so we know that both the PhD and DNP leaders are trying to advocate for population health initiatives. We have a great organization here in Texas called the Texas Nurse Practitioner Organization. Both is actually led by President, who's a DNP, and they are literally campaigning and I'm sorry, not campaigning, but they're on the Capitol having meetings and advocating for better care for patients at that level. So I think that that's something that DNP should continue to do. And then we also have a growing number of DNP entrepreneurial roles that have been developing over time. I don't think we've even captured that data, because there's a plethora even of my students that have left and called back to say, hey, Dr. Thaxton, I've started my own practice, or I'm now running an infusion clinic of my own, or have some type of small business entity. After they leave the program, they feel led to become their own type of entrepreneurial skill set that they have as a, side on the side or whatever. But I do think that we breed leaders in this field, stronger leaders.
And I think from the academic perspective, we are starting to see and have seen in some schools where, they don't have that hierarchy where, DNPs can't serve in tenured positions. There are plenty of schools out there where you can. And I think, that recognition is strong, and I think it's good. And, just like any new person to academe, you need to be well supported when you first start, if it is a new role for you. And, I like what Dr. Thaxton was saying in terms of, being at the table, for like policy issues. I think that's really important. And, I think Another area that we've seen is in states where we do have full practice authority from the APRN perspective. I think having that DNP skill set just arms you that much better, to be able to go out and do these entrepreneurial things. So, I think it's a collaboration between, everyone to ensure that we're really pushing those policy issues forward and using the data, again, maybe in collaboration with our PhD colleagues to ensure that we have a really strong story.
Mhm.
And just to add a little bit with that, I think in academia, in academia and practice is the interdisciplinary collaboration that DNP prepared nurses who are well equipped to collaborate with other professionals, other disciplines across the spectrum, not only in academia, but in clinical practice is there. And oftentimes it's the DNP prepared nurses that are the in for us who have PhDs and are, want to do research. So I think in academia, there's a lot of opportunities specifically to that. And I'm glad that Dr. Thaxton has served in an institution on a dissertation committee. Now as the assistant head for graduate programs, maybe I can make that change in my organization because it's not there at the moment. The other is program development in academia. PhDs, we oftentimes think that we know it all, especially when it comes down to clinical practice, but who to better ask than our DNP colleagues who are embedded in clinical practice, right? To make those clinical programs, whether it be at the master's level or even the doctoral level, and give us that feedback as to what is needed out there in our healthcare system currently that will advance nursing and advance patient care overall.
And I think to expand more on the practice, because I'm still practicing as an acute care nurse practitioner, but I'm also in the assistant dean for clinical practice and relationships at Johns Hopkins School of Nursing. So I have practice and I have my academic hat. But in terms of practice, I know for me, when I finished with my DNP, it definitely changed the lens on which I practiced and managed my patients. I was a whole lot more in tune to really looking at the evidence and making sure the decisions and the management strategies that I implemented were aligned with the evidence, or it definitely deepened me to ask more questions as to why and dig deeper, like what structure or what systems are impacting this patient's care, or why we can't get certain resources, or how can I get advancement with different policies, procedures to advocate for what our team needs in order for us to best take care of our patients. In addition, I really felt like I was able to feel more comfortable and confident to sit at the table with my physician colleagues. One, I had to do a lot of education about what me being DNP prepared meant. And then two, allowing them to understand that calling me doctor is okay because I have a doctorate in nursing practice, and really teaching them of what that meant and how that value showed up in practice. But it took a lot from myself to be consistent in showing that value. So taking initiative on various QI, PI projects, leveraging some of my leadership skills and creating a system-wide, we call it the Doctoral Nurses Collaborative, where we combine PhD and DNP prepared nurses into this group. And we assisted, we served as kind of like a consultation for physicians that wanted to do QI, PI projects. And so we served in the capacity of helping them design what the QI stuff looked like, helping with literature review, and then submitting for IRB. So they were able to see some of the value that we can really shine in the QI PI space. So that really fostered a mutual respect and understanding of the value that we brought. So definitely in practice, it really showed the difference. And on the team that I work on, we probably have at least 10 DNP prepared nurse practitioners, and just the level of scholarship discourse that we would have at our clinical conversations. I mean, it was like really deep and really expansive because we were able to kind of have that depth and breadth of clinical knowledge that we really sought out to have as clinicians. So it really enriched our conversations, the way we thought and the way we practice. So also, I want to kind of have another provocative piece to ask the panelists. So for me, really marketing and branding and telling my colleagues it's okay to call me Dr. McCamey because I have a doctorate. So we all know this is a hot spot, and it's always been a hot spot in terms of, can we call anyone outside of physicians doctor? And so I would love to hear your perspective on the title doctor. Can we call ourselves doctor? Do you believe we should or should not? And so just want to offer that question up to Dr. G first.
Yeah, so this is a really this is a point of contention for me, because I'm a big advocate for anyone who has a doctoral degree being able to call themselves doctor, regardless of the setting. It fails me as to why our physician colleagues oftentimes want to pull that away from us as nurses. Well, I know why. Medicine's patriarchal and sometimes misogynistic, and so they see nurses as subservient to their practice. And so now that nurses oftentimes have more education in the sense of the DNP and even the PhD, they don't want to lose the respect, unfortunately. And the funny thing is that they won't question a dentist, they won't question a chiropractor, they won't question a podiatrist, and in them using that title doctor, but they will question nurses. And I think we need to start calling them on the carpet and asking them why. I mean, with DNPs of color, we talk about health inequity, we talk about racism and things like that. In this case, we honestly need to start asking and majority of physicians happen to be men. We need to start asking them the point blank question. Is it because you're a male and you don't want to call a female doctor? Despite them having potential colleagues that are female physician colleagues, why is it any different for a nurse who has a doctoral degree to be referred to as doctor? And unfortunately, organized medicine has actually taken this and worked with legislators, and actually laws have been passed preventing nurses with doctoral degrees from using that title in the clinical setting. I think we need to fight back. I was at a conference this morning with my students, and the speaker actually said, "We are nurses. We are the largest number of healthcare providers in the United States. If we were to come together as a whole, we could squash a lot of this stuff, but we have to make the choice to become involved, and that includes things like policy and communicating with our legislators and saying, why is this okay?"
And I back on that, I think you're right. Like, we do need to get involved, but money talks, and organized medicine has a lot. And one of the big differences, that I always advocate for with students is, please join a professional organization, because medicine, it is a given. Like, they are all part of the AMA, whereas when you ask nurses, are you part of A&P, or are you part of whatever, ANA, the numbers are, they're so small compared to medicine, even though we are larger numbers. And so I think it starts early, in nursing. I think, again, when you look at how many people treat it as a profession versus a job, I don't know if that carries on when they become, in these, higher levels, but I think we have to, put our money where our mouth is.
I think definitely I agree with you both, and I agree with Dr. G's very transparent explanation. I do see that this trickles not into nursing, but also education. I mean, look at Jill Biden. She has her doctorate, but they still continue to call her Jill Biden. So it just happens, and we have to be that voice to be consistent, to advocate for ourselves as Dr. whomever.
And I think there's another point, Dr. Thaxton, and I acknowledge my privilege as a male. Because I can have these conversations and call them out really quickly. But it can be difficult for my female colleagues to have that conversation with, again, a field that is predominantly male. I think as nurses, we've been accustomed to wearing the white gloves, right? And being very genteel, but medicine can be those in medicine can be very abrupt, and they'll say it, right? So why do we have to continue to function the way we have? And I'm at a point where I'm like, white gloves off, boxing gloves on.
I have seen some examples in practice where there have been NP-led teams with DNP prepared NPs and MD-led teams in the neurosurgical ICU at Johns Hopkins, for example, where they have their own group of patients, and so they become more familiar in practice working side by side with the skill set of one another, and maybe garner more respect for the DNP prepared advanced practice nurse, and their judgment and ability to manage care for, acutely and critically ill patients. I think we have to kind of get in there and, take leadership of teams and demonstrate, that our acumen.
I would agree. And I think we had a question in the chat that asked if you think more DNP prepared nurses were invited and retained to teach, would that help with the nursing shortage?
I can answer that. I actually had part of a question that I think you had asked, or Karen had asked, about what do we think the DNPs of color can do as a charge. And one of the ideas or suggestions I had was really to continue to support the development of strong mentorship programs. And I do think we can model, to answer that question, we can model that through mentorship programs and continue to teach, and also increase in knowledge of grant writing and support the advancement of scholarship and publications in the field. So I think having DNPs as faculty, yes, that has helped, but we even need to have mentorship for junior faculty to grow those faculty, because mentorship, as you know, works both ways. The mentee grows and the mentor grows. So as we have more and more DNP faculty, that come to help with that nursing shortage, we'll be feeding, kind of train the trainer models, or whatever you want to call it, but we'll be feeding in and paying it forward to the next generation of DNP leaders. So I'm a strong advocate for mentorship, and that's one of the charges I'd have for DNPs of color, to make sure that we're having good, strong mentorship programs and increase the knowledge of grant writing and scholarship and publications, because that's the way we can advance our skill set and show kind of the world what we have to offer.
I really like what you said. And I think it's important too, to make sure you have a seat at the table. I was sharing with someone the other day that when it came to my last institution, they really focused as an academic on publications, and okay, that's great and fine and all. But, I was able to showcase that through other alternative methods, I was really making a big impact on the clinical setting, not through maybe a traditional publication, but an op-ed that was written that got picked up by a gazillion different places. And I was really, appreciative of the fact that they broadened the criteria. So from a clinical track perspective, they were, they respected the fact that I was making a clinical impact in a different area versus just a traditional publication. But it really took a lot of advocating for myself to ensure that that happened. So I really like your idea of making sure that we mentor people, because you're right, in the end, there are institutions that are going to, your publications are your, that's your productivity, and that's what they're going to measure you on. So you can't let that go by the wayside. But also making sure that, you find yourself in a place that values what you bring to the table.
Imelda, I'll have to agree, because I think that you and I were having a question about ways to, I call it bust up the academy, because I know for me, my scholarship is more external, more in the social media space. And I always call myself, we have a group call ourselves the social media Socrateses, because when you think back in the day, how was scholarship disseminated? It was, you know, in community, it was externally, it was socially, it was verbally. And you think about how history was passed down, the stories and the folklore, folk tales. And so for me, I'm definitely on a quest. And I feel like with DNPs of color, you know, one of the strategic focus is changing the game and forging new paths. And for me, that means emulating what scholarship is today and how it's relevant for the generation that's going to be taking that knowledge to the next level. And it may not be in the journal that you have to pay for or be a member of and pay thousands of dollars to have access to that knowledge. It might be in somebody's retweet that's gone viral that connects to the free open access journal article that has a title. Dr. Gillis and I are writing an article that says, "I'm rooting for you, sis, the importance of faculty of color having mentors of color." So I think that really changing the game and the structure and the way scholarship is I think this generation is requiring it. It's demanding it. And I see that as an academician from my students. Nobody wants to read a book. And at Hopkins, we're looking at, you know what, let's just get rid of the books. We have ebooks and like e-learning and, you know, sound bites and like micro kind of credentialing type of education, because that seems to be relevant for the way the learners are now. And but really broadening up what social scholarship looks like. And I think being DNP prepared, and because there's more than 50,000 of us out here in these streets, that I think academia is going to have to start looking to us to fill in some of those faculty shortage gaps and upskilling us and us acquiring the additional knowledge and education to be able to function in the academic spaces. So I'm definitely a living example of that. And so is all the panelists, actually.
I will say, though, I draw the line at TikTok. Like, I'm not teaching through that. But I think the other thing too is when you find yourself in a position like, you know, I'm now the Associate Dean for grad education, and I find myself constantly having to educate my colleagues to ensure that they understand that, you know, that importance of both PhD and DNP, tenure track and, you know, teaching track. And so I can't let my guard down, you know, and I won't. And so I think, you know, at all the institutions I've been at, I think that's been, you know, when you find yourself in a position where you can influence, you know, use it. Like, don't let it go to the wayside.
One of the things that I'm really passionate about is creating a yardstick to measure metrics of practice scholarship that looks entirely different from traditional scholarship, the number of, you know, printed manuscripts that you have, or, you know, what the impact factor is for the journal. I'm looking with my students to encourage dissemination in such a wide variety of forms, and looking at open access repositories and exchange of information across professions and dissemination on social media, as well as, and looking at the number of hits and the number of countries and the number of universities that are accessing the information as metrics that we might use. So I think that's really needed. The idea of tenure, who knows, maybe, you know, in the next lifetime, it'll be gone. But in the meantime, hopefully we can help to define like QI metrics for our PhD colleagues who don't feel comfortable with QI metrics, and show the rigor of the scholarship in that regard. I'm getting on my soapbox, sorry.
I love it, Dr. Kesten. And since we're kind of running low on time, I do want to kind of center some call to action questions. And so how do you think organizations like DNPs of color can support or provide value to DNP prepared nurses?
I think
So-
oh, sorry. Go ahead.
Go ahead.
Okay. I was just going to say, I think, these types of events, really, again, start the conversation, get the conversation going, keep the conversation going. And I think it's really being able to support one another. And, I think my, big thing that we can do as DMPs of color is really kind of, outline what you should be looking for in a DMP program, and helping people, because you have options and there's lots of, things out there. But, I was really picky when I was looking at my DMP program, and I wanted, to again be that clinical expert. And so be careful, what you choose, what you find to be important, and find a program that meets your needs.
And I think organizations like DMPs of color can offer a variety of different things for different individuals, things like networking, mentorship, advocacy, education, and training, all which Dr. McCamey has put together, which is just an amazing, amazing feat. I'm always speaking about docs. And we know that nursing has always been a noble profession, and the DNP degree is a testament to the dedication and hard work of nurses who seek to elevate the skills and the knowledge to the highest levels, right? However, we again, from the conference this morning, I learned so much. We can't remain stagnant, because what happens to a body of water that's stagnant? We start to stink, right? We don't want to be stinky. So we want to be fresh all the time. So the healthcare industry is constantly evolving, and we must be prepared to adapt and innovate in order to meet the changing needs of our patients. So the charge to nursing and the state of the DNP degree is obviously to continue pushing the boundaries of what is possible. Never take no for an answer. Always push. Be that squeaky wheel, right? We must challenge. We also must challenge ourselves to explore the new frontiers in healthcare, and to think creatively outside of the box, and how we can improve patient outcomes and work collaboratively across disciplines to achieve our goals.
Nice. Love it. Not much I can say after that, Dr. G. I would just say some keywords are definitely innovation, partnerships, but also mentorship, because, for the next generation, they need leaders from the DNPs of color to pour into them, to show them how, teaching, service, and scholarship, how do you grow in those areas? I know I didn't learn much about growing in service until I became a DNP and got, on different national committees. But I think that the mentorship piece is really a key, because we're leading the way and showing the way, and, being that network support that, students need and new grads need to get their voices strengthened, and to partner them with even, PhDs, doctors, their whole interdisciplinary team to understand what they have to offer. And mentorship is the key to doing that, really.
Yeah, and I totally agree. And I think as individuals in this session who have joined us today, whether they are DNP prepared or not, or seeking a potential DNP degree, they just need, I think my final words are just to be bold, visionary, and courageous, because that's what the DNP degree will bring for you if you use it the right way.
I would agree. And we as an organization, DNPs of color, have coined the year 2023 as the year of changing the game and forging new paths. And I think, when we were conceptualizing what the theme was, because that was the theme of our conference last year, but really want to infuse the power, the understanding of the power that we have in this community, being DNP prepared, and understanding that once having this level of education, it brings you to different tables, and with bringing yourself to different tables, you have a voice, and exercising that voice to think about the policies, procedures, the clinical issues, and bringing those forward, and really making some transformative, progressive change. And I think that really setting up the stage that we're changing the game and forging new paths, meaning we can't do things the same because it's not working. And we all can agree and attest to that. But understanding that each of us individually, we have a mission, And we should feel empowered to operate in our respective passions to fulfill that mission to forge new paths. And so that's the kind of piece that I would love to leave with you all this evening as we go forth. And I don't know if we want to do one question from the audience or close out. What do you think, Dr. Kesten?
I have a question in mind.
Okay, perfect.
If we have time for one.
Yeah,
Someone in the chat asked about postdocs, about postdoc fellowships, and I've had good luck with nominating my DNP graduates and DNPs in practice for postdocs, especially interdisciplinary. Is there anything that DNPs of color could do in that regard?
Yeah, that's what I'm waiting for, to be invited to Oprah's couch to get some substantial funding. We do have what we call the Docs Institute, which is programming that we've conceptualized that essentially is post-DNP fellowships. And from our community, we found that kind of the hotspot areas that folks want more knowledge, more skills are having faculty education, having research education. There's a growing body of DNP prepared nurses that want to engage in nursing science and generating new knowledge. And then the third piece is our clinician leaders. How can we support in adding more additional skills, knowledge, education around developing more of the clinician leaders beyond the initial DNP education? So we're on the lookout for some funding to start launching the post-DNP fellowship that we're calling the Docs Institute. We are, again, host of programming just to get conversations going, and our annual conferences so far have had amazing programming and speakers highlighting the level of scholarship and excellence. And we just finished our first Pathway to Publication mentorship program where we partner with Jonas Nursing Veterans in Healthcare to pair up Jonas alumni scholars with doc scholars that hadn't published their DNP projects within 2 years of graduation. And we were able to get our 9 mentees to publication-ready manuscripts. And so far, we've heard 2 have actually gotten accepted for publication. So we're waiting for the rest of the cohort to give us that good news as well. So stuff is on the pike. We are entering our 3rd year of being operational. So we're young, but we're mighty, and we're just thankful for the opportunity to be able to be of service in this capacity as we continue to build as an organization. So with that, I am going to begin our closeout here. I'll pass the mic over to Latrina.
Hey everyone, I am Latrina. I am one of the board of directors for DNPs of Color. We are excited. So I need everybody to mark their calendars. There has been some great discussion today. October 19th through the 22nd, we are going to be in DC. So we are asking all of you to join us in Washington, DC. We are calling all the game changers and trailblazers for our 3rd annual conference this year. It's going to be exciting, and we hope that you'll join us.
Yes, please save the date. And we thank you all for coming out tonight. We did record. The recording will be available in the next couple of days. Please go to our website, www.dnpsofcolor.org. Please tweet us, follow us at DNPs of Color. We're on Instagram, Twitter, Pinterest, YouTube, LinkedIn, Facebook. Please keep up with us. Let us know if you have any thoughts, feelings, suggestions. There will be a survey that's sent out after this talk and within a couple of weeks. So we really would love your feedback. And thank you all for joining us tonight as we discuss the state of the DNP degree. You all have a great evening.
Thank you.